Hello everyone, my Outbreak case study is on AIDS in the 1980s. I want to recognize that AIDS is still an illness that exists today, but for the purpose of this Outbreak study, I will just be focusing on the early days of AIDS, which was in the early 1980s. My name is Laura Johnson, and I am a sexual health educator here in Tulsa, and I'm also a master's of public health student. So to introduce AIDS, the AIDS epidemic in the United States first became prominent in June of 1981. So it's important to note that AIDS is the acquired immune deficiency syndrome, and this attacks the immune system, which is your system that fights off illnesses. So in June of 1981, there were 5 gay men in Los Angeles who were otherwise healthy who were admitted to the hospital with pneumonia. Then in July of 1981, gay men in New York began dying of pneumonia as well. Then by September of 1981, there were 593 cases of AIDS reported to the Centers for Disease and Control and Prevention, which is known as the CDC, and there were 243 of those cases that resulted in death. So at this time, people were really afraid of AIDS. There was very little knowledge on it, and most cases resulted in death, which was really scary for the public. Some epidemiological context. At this time, it was believed that AIDS could be spread through sexual contact, the transfusion of blood, sharing needles, so that's like intravenous drug use, and pregnant person to child. It's really important to note that the risk factor for AIDS at this time was mostly being a homosexual and bisexual man. This is where a lot of that homophobia and stigma was created because most people, as we'll see in the next slide, most people who had AIDS at this time were gay or bisexual men. So this is where that stigma came from. So as you can see in this graph here, we have the black line, which is like diagnoses of AIDS. We have the blue line, which is deaths as a result of AIDS. And then the green line is prevalence. So prevalence is the frequency of an existing disease. And in the early days, you can see that prevalence, death, and diagnoses were increasing exponentially. So in that first half of the graph, everything is just increasing really rapidly. Around 1993, after treatment became available, there was a decline in deaths as well as diagnoses. And this can also be due to that there was more education that was more accurate about how to prevent HIV. So that's why we can see this decline. So we see the decline in diagnoses as well as deaths because people are living longer with AIDS. And then people with HIV and AIDS are living longer, like I said previously, which is increasing that prevalence. So because prevalence is the frequency of an existing disease, because AIDS is really no longer a death sentence after 1993, that's why prevalence is really shooting up there, because there are more people who are living in the US with AIDS. Here is a breakdown of persons with AIDS by characteristics from 1981 to 1987. Again, this is not the only time that people have ever had AIDS. We're just exploring this time in our history. So the characteristic for sex, the most people who had it were men. For age group, it was people ages 30 to 39. For race, it was mostly white people. For region, it was the Northeast. And for vital status, it was deceased. So what that means is that most people who had HIV, you can see from the chart, ended up dying. It was 95.5% of people with HIV were dying. So again, this is why people were really, really afraid of this illness, is because it resulted in death, and there was just so not very much information about it that was out. So because much of AIDS was unknown, the investigation efforts were limited. It's also important to note that the investigation efforts were limited because it mostly impacted gay and bisexual men. So there was not really an urgency to help this population of people, so that's why efforts were limited at first. However, there were some diagnosable symptoms. Those included unexplained weight loss, as well as fungal infections and swelling of the lymph nodes. It was also determined that symptoms of AIDS could start to appear as late as 2 years after exposure. Finally, in 1985, it was determined that AIDS was caused by the human T lymphotropic virus type 3, which was abbreviated to HTLV3. And since that is a mouthful, it is known today as HIV, which is the human immunodeficiency virus. So when the virus was discovered, antibody testing is now used. Antibodies are things that your body makes to fight off infections. So in the case of HIV, someone's body is now making antibodies to try to fight that infection off. Those antibodies won't be able to fight the infection off because HIV is a forever virus. However, they still will be present. So there's a window period for antibody detection, and at this time it's still known. A window period is a time from when someone is first exposed to when their antibody test will come back positive. So the current estimate is 4 to 7 weeks, but the antibody test was not super accurate at this time. It often resulted in false positives, which means that they were coming up positive and the people did not actually have HIV. At this time, the AIDS case reporting system was also established. So this was to track cases around the US, and physicians were required to report new cases that they were diagnosing. So originally, these cases were reported by name. So physicians would submit the names of their patients who they had diagnosed. But after much protest in 2003, case reporting became confidential. So it was no longer associated by name. People felt, rightfully so, that this was a violation of their privacy, and that they had no right to share this information with public health officials. And this information that was collected was sent to public health officials like the CDC to help prevention efforts and to know where those initial outbreaks were really, really prominent. So the spread and impact, this is a breakdown of the people who had it at this time. So the affected population groups, 75% of people with AIDS were gay or bisexual men. So again, this is where those lack of efforts result from. This is where that stigma was born. Additionally, 12% were intravenous drug users, 6% were Haitians, 3% had hemophilia, which is a blood disease where you need transfusions often, and 5% were of unknown causes. So at this time, the mortality rate when diagnosed within a year of exposure was 41%, and the mortality rate when diagnosed after a year since exposure was 60%. So again, the prognosis is not looking great. Most people who had HIV are dying within a year, live maybe past a year, but not much longer than that. There was a huge impact that HIV and AIDS had on society. People were scared of AIDS because at this time it was a death sentence. People were so afraid that in 1983, the National AIDS Hotline, or the NAH, was established to calm the public. So this was a hotline where people could call in and ask questions about AIDS, where they could have people who are educated on the subject give them those answers. And this kind of helped calm the fear that the public was having. The other societal impact was discrimination of gay men, and this resulted in social isolation, loss of employment, denial of medical care and services, and the inability to donate blood. So again, it's really impacting homosexual people, unfortunately, just because of that stigma. The healthcare impact, because very little was known about AIDS at this time, providers were afraid to care for their patients. Because it was not super well known how this was spread, providers were not providing their patients quality care, and were not giving them as much care as they needed. Many patients were also afraid to seek care at hospitals that had been known for caring for people with AIDS in fear that their employer would find out. So if their employer provided insurance for them, if that hospital billed that insurance company, they were afraid that their employer would see that they were at that hospital and would assume they would have AIDS. And as I mentioned earlier, lots of people who were assumed to have AIDS would lose employment. Additionally, there were staff and facility shortages. So because so many people were getting sick in one location at once, it was really hard to treat all of these people and have space for all of them. However, it did result in shortened stays, which can be a bonus for both health insurance companies and people, because being in the hospital is not fun. The economic impact as well was a lifetime cost of AIDS was estimated to be around $80,000. It's important to note that for today's money, that is around $270,000. Also, this $80,000 was applied to someone who had AIDS, and at this time, that lifespan was only a few years. So if someone were to live longer than the lifespan of someone with AIDS at that time, it could cost much more than that. Over $1 million a year was spent on testing, which is $350 million today. Over 200 million a year was spent on research and education, which is $670 million today. And after treatment for AIDS was discovered, the yearly cost shot up to around $8 billion, which is around $26 billion today. So overall, HIV and AIDS has really impacted like the economy because so much money has to be allocated for this disease alone. For control measures, these were the following recommendations for control. Universal precautions were implicated. Were implemented, sorry. So universal precautions is wearing gloves and using biohazard disposal cases. It's essentially protecting yourself when blood is present. And so this was implemented all throughout the US. There was also a push for comprehensive AIDS education and expressing the importance of condoms to prevent the spread of AIDS. It was also recommended to avoid sexual contact with high-risk populations. It's important to know that those high-risk populations were gay men. And then high-risk populations were banned from donating blood. So the evaluation of these control measures, for this time, prevention measures were the best that public health officials could recommend. Because there was no treatment and they really didn't know how it was spread yet, prevention was the best thing that they could do. However, this gave space for homophobia because many of these prevention efforts were just for gay people. When we compare modern practices to the AIDS epidemic, one thing that came to mind for me was Mpox. Mpox is also referred to as monkeypox, but Mpox is more culturally appropriate, so I'll be using Mpox throughout this slide. The similarities was the homophobia. So Mpox is mostly spread through men who have sex with men, and so like with AIDS, there's a lot of encouragement for prevention for only men, which encourages the stigma that only gay people can have these illnesses, which is not true. And additionally, as most illnesses, as well as AIDS, it disproportionately impacts people of color. One of the differences is response time. So for Mpox, this was declared a public health emergency within months. As well as the Biden administration acknowledged Mpox and was working with LGBTQ plus organizations immediately to find out how they could prevent the spread, how they could stop this stigma, which is not something that happened with AIDS. AIDS was not acknowledged by the government until like 2 years after it's first started spreading. And the other difference is this is not a new virus. So testing measures and treatment already existed. So that is why the government had better response efforts and they were significantly quicker and more thorough, and why the White House acknowledged homophobia spreading due to Mpox. So it was really important that we already had the tools to fix this, and that played a big role in how fast. However, I do think that AIDS taught people a lot about how to stop the spread of the disease, the spread of a disease early, and this definitely impacted Mpox. Those prevention efforts were put into place really soon after the beginning of the spread. So I wouldn't be a sexual health educator if I didn't tell you how HIV is actually spread. So although my presentation focused on those early efforts and there was no information on how it spread or how it works, there is information on it now. So HIV is spread by contact with an infected person's semen, vaginal fluids, rectal fluids, blood, and breast milk. It's important to note that you can only get HIV or AIDS from someone who has it. So if someone's fluids who doesn't have HIV or AIDS gets on to someone else, it's not going to come out of nowhere. It's also important to note that HIV is no longer a death sentence and can be managed with something called antiretroviral therapy, or ART. What ART does is it lowers the viral load in the body of HIV so that someone can live a perfectly normal life. It's also really important to note that anyone can contract HIV, not just gay men. So in conclusion, in the 1980s, AIDS was a new infection that was not well understood by medical professionals. Many people who contracted AIDS at this time ended up dying, creating great fear amongst the public. Because AIDS primarily impacted men who had sex with men, homophobia increased during this time. The initial outbreak of AIDS is relevant to current and future public health challenges because it outlines the importance of research, education, and prevention. When governments do not acknowledge and educate the public on viruses like HIV and AIDS, misinformation can impact individuals at risk. HIV and AIDS still exists today, with around 39 million people living with it worldwide. According to the World Health Organization, ending AIDS by 2030 is achievable if we keep our efforts strong. This is my slide of references, and I would just like to say thank you so much for listening to my presentation today. I really appreciate it, and I hope you have a great rest of your day. Thanks.